The median one, that is known as mediastinum, and these are the two lateral pleural cavities containing lungs. So first of all, the definition of the mediastinum, it is the central partition that lies between the two pleural cavities, between the right and the left pleural cavities. This central partition, the intermediate medial partition known as mediastinum. So all of you should know about the definition of the mediastinum, that is a central partition between the two pleural cavities, and includes all the structures that lies in this intermediate compartment of the thoracic cavity. After the definition, then there is our boundaries of the mediastinum. The overall boundaries of the mediastinum, this is the central partition. Anteriorly, it is bounded by the sternum. On the posterior aspect, it is bounded by the thoracic vertebrae. Superiorly, there is an superior thoracic aperture, and inferiorly by the diaphragm, and on each side, there are two pleural cavities. The boundaries of mediastinum, that is the central or median compartment of the thoracic cavity, anteriorly bounded by the sternum, posteriorly by the bodies of the thoracic vertebrae, superiorly by the superior thoracic aperture, and inferiorly by the diaphragm, and on each side there are the two pleural cavities. Okay. So they are forming actually the lateral boundaries of the mediastinum. Then there are different subdivisions of the mediastinum. This median partition further subdivided into two main parts, the superior mediastinum and inferior mediastinum, by a transverse thoracic plane. This transverse thoracic plane is an imaginary plane. This is the transverse thoracic plane, that is actually a imaginary plane, lies at the level of the sternal angle anteriorly, and posteriorly it reaches at the level of the intervertebral disc between T4 and T5. So the plane which divides the mediastinum into two main parts, the superior and inferior mediastinum, is formed by a imaginary plane known as transverse thoracic plane that extends from the sternal angle anteriorly to the intervertebral disc of the T4 and T5 on the posterior aspect. This plane is known as transverse plane, or simply known as a horizontal or transverse plane. Above this plane, the part of the mediastinum known as superior mediastinum. Below this plane, the part of the mediastinum, the subdivision of the mediastinum known as the inferior mediastinum. So this is the inferior mediastinum. Above the plane, the part of the mediastinum known as superior mediastinum. The inferior mediastinum then further subdivided into three other parts: the anterior mediastinum, middle mediastinum, and posterior mediastinum. And the structure which divide the inferior mediastinum into three subdivisions is the pericardium. So the part of the mediastinum, inferior mediastinum, lies in front of the pericardium, known as anterior mediastinum, lies posterior to pericardium, known as posterior mediastinum, and the pericardium along with the heart contains the middle mediastinum. It forms the middle mediastinum. Superior and inferior mediastinum, then inferior mediastinum further subdivided by the pericardium. Anterior to pericardium, the part of the mediastinum known as anterior mediastinum. Within the pericardium and the heart, these are all the contents of the middle mediastinum, and posterior to the pericardium, the part of the inferior mediastinum known as posterior mediastinum. जी मुबीन।
मैम ये ट्रांसवर्स थोरेसिक जो प्लेन है इसको हम एक्सटर्नल एंगल बोल सकते हैं?
एक्सटर्नल एंगल सिर्फ उसका इंटीरियर पार्ट पे है ना, सारी नहीं है। Transverse thoracic plane that passes from the external angle up to the level of the posterior side in the intervertebral disc between the T4 and T5. तो ये पूरा जो प्लेन एक्चुअली बन रहा है ना, उसको कह रहे हैं। आप फिगर में देखो इसे, ये है ट्रांसवर्स थोरेसिक प्लेन। क्योंकि एक्सटर्नल एंगल तो सिर्फ ये वाला पार्ट है ना, मैनिब्रो एक्सटर्नल ज्वाइंट इज नोन एज एक्सटर्नल एंगल। इस प्लेन को हम कह रहे हैं ट्रांसवर्स थोरेसिक प्लेन दैट पासेस फ्रॉम द एक्सटर्नल एंगल टू द इंटरवर्टिब्रल डिस्क बिटवीन T4 and T5.
Okay, ma'am.
G. Then the superior mediastinum. The boundaries of the superior mediastinum anteriorly. And now these are the specific boundaries of each mediastinum. Superior mediastinum is anteriorly bounded by the menibrum part of the sternum, posteriorly by T1 to T4 vertebrae, superiorly by the thoracic inlet, and inferiorly by that horizontal plane or transverse thoracic plane, and on each side there are the two pleural cavities. So these are the boundaries of the superior mediastinum, anteriorly bounded by the menibrum part of the sternum, posteriorly by T1 to T4 vertebrae, on each side the pleural cavities, superiorly by the superior thoracic aperture and inferiorly by the transverse thoracic plane. Now the contents of the superior mediastinum, it contains from posterior to anterior side. The first content is the esophagus. So the first content of the superior mediastinum is the esophagus from the posterior aspect. So here is the esophagus. Anterior to it, the trachea. Anterior to the trachea, now there are major vessels of the superior mediastinum, the arch of aorta along with its three major branches, the brachiocephalic trunk, the left common carotid, and left subclavian arteries. See in this figure. So these are the main contents of the superior mediastinum, the esophagus. Anterior to the esophagus, the trachea. Anterior to the trachea, these are the major vessels, the arch of aorta, and these are the three main branches of the arch of aorta, the brachiocephalic artery, the left common carotid, and left subclavian. And two brachiocephalics, the right and the left brachiocephalic veins that unite to form the superior vena cava. Along with that, the thymus gland is also one of the content of the superior mediastinum. The other contents of the superior mediastinum are in the nerves, the right and the left vagus nerves, right and the left phrenic nerves, the sympathetic trunks on the right and the left side, and the left recurrent laryngeal nerve, that is one of the branch of the left vagus. In the lymphatic structures, the thoracic duct and the superior mediastinal group of the lymph nodes. These are all the contents of the superior mediastinum. The main structures from posterior to anterior side, the esophagus, then there is an trachea. After that, the major vessels, the arch of aorta and its three main branches, brachiocephalic, left common carotid, and left subclavian. The two brachiocephalic veins, right and the left brachiocephalic, that unite to form the superior vena cava. Another content is the thymus. In the nerves, the vagus nerves, phrenic nerves, sympathetic trunk, left recurrent laryngeal nerve, and in the lymphatic structures, the thoracic duct and the lymph nodes. Then the inferior mediastinum, the first subdivision of the inferior mediastinum is the anterior mediastinum. The anterior mediastinum is bounded anteriorly by the body of the sternum, posteriorly by the pericardium, superiorly by the horizontal transverse thoracic plane, inferiorly by the diaphragm, and on each side again the pleural cavities. So the boundaries of the anterior mediastinum, anteriorly by the body of the sternum, posteriorly by the pericardium, inferiorly by the diaphragm, superiorly by the transverse thoracic plane, and on each side it is bounded by the pleural cavities. The contents of the anterior mediastinum, it is the smallest subdivision of the mediastinum and only contains the loose connective tissue, the face, a ligament, the sternopericardial ligament that connects the sternum, posterior end of the sternum with the pericardium, the lymphatic vessels, mediastinal group of the lymph nodes, and the branches of the internal thoracic vessels. In infants and children, the anterior mediastinum also contains inferior part of the thymus, but after the puberty, the thymus regresses, so it only lies in the superior mediastinum.
पोस्टीरियर बड़ी बताई मीडियास्टिनम
कौन सी mediastinum की?
पोस्टीरियर
Boundary of which mediastinum?
अभी जो ऊपर पिक्चर में आपने दिखाया
एंटीरियर मीडियास्टिनम की बात कर रही हैं आप? जी देखें आप इस फिगर में जी।
तो इसमें आपने स्टर्नम के पीछे पोस्टीरियर क्यों बोला कि वहां पे पेरिकार्डियम होता है?
तो anterior mediastinum is posteriorly bounded by the pericardium ना, ये है ना anterior mediastinum,
होगा ना,
तो ये posterior है ना उसके, यहाँ पे ये anterior mediastinum एरो नजर आ रहा है आपको? This is the anterior mediastinum. Anterior mediastinum की हम बात कर रहे हैं कि वो anteriorly bounded है by sternum, posteriorly by the pericardium. ये है ना पेरिकार्डियम, तो वो उसको पोस्टीरियर बाउंड्री बना रहा है ना इंटीरियर मीडियास्टिनम की।
अच्छा ठीक है,
इज इट क्लियर?
हाँ
ठीक। In the contents, that is the list of the contents. It only contains the loose connective tissue, fats, lymphatic vessels, lymph node, the sternopericardial ligament, branches of the internal thoracic vessels, and only in the infants and children. It contains the thymus, but in adult life, the anterior mediastinum only contains these structures because of the regression of thymus, and then it only lies in the superior mediastinum. Then another subdivision of the inferior mediastinum is the middle mediastinum. The middle mediastinum is composed of pericardium and the heart, along with the major arteries, the ascending aorta and the pulmonary trunk. And in the veins, it contains the lower half of the superior vena cava, termination of the inferior vena cava and the pulmonary veins. And in the nerves, the phrenic nerves lies in the middle mediastinum and the lymph nodes. So the main content of the middle mediastinum is the heart along with the pericardium. Then the major vessels like pulmonary trunk, here is the aorta, termination of the superior vena cava, inferior vena cava, and pulmonary veins that enters into the heart. Then in the nerves, it contains the phrenic nerves and the mediastinal group of the lymph nodes. These are the main contents of the middle mediastinum. Now the posterior mediastinum is bounded anteriorly by the pericardium, along with the sum of the part of the diaphragm, posteriorly by the lower 8 thoracic vertebrae, superiorly by the horizontal plane, transverse thoracic plane, inferiorly by the diaphragm, and on each side by the pleural cavities. Again, see in this figure, these are the boundaries. Here is an posterior mediastinum. Boundaries of the posterior mediastinum, it is bounded anteriorly by the pericardium, posteriorly by the lower 8 thoracic vertebrae, superiorly by the transverse thoracic plane, inferiorly by the diaphragm, and on each side again the pleural cavities. The contents of the posterior mediastinum, it contains the esophagus along with the esophageal plexus, the thoracic duct, right and the left vagus nerve, ascending aorta, azygous veins containing the azygous, main azygous and the hemiazygous veins, right and the left sympathetic trunks and their branches like the splenic nerves, and the posterior mediastinal group of the lymph nodes. So the esophagus, after it lies in the superior mediastinum, that it runs downward and passes through the posterior mediastinum. along with the esophageal plexus, the thoracic duct with one of the lymphatic duct, right and the left vagus nerve. Here is the sympathetic trunks, the right and on the left side, the left sympathetic trunks, azygous and hemiazygous veins, branches of the splenic nerves. Splenic nerves are the branches of the sympathetic trunks. Here is the aorta. Descending aorta are thoracic aorta and the mediastinal group of the lymph nodes. So these are the main points related to the mediastinum. First of all, the definition of the mediastinum, then boundaries of the overall mediastinum, then subdivisions, superior and inferior mediastinum, then respective boundaries of the superior and inferior mediastinum, then further subdivisions of inferior mediastinum, anterior, middle, and posterior mediastinum, and then contents of each mediastinum. Now, any question related to the mediastinum? बेटे जब आप एओर्टिक आर्च को डिस्क्राइब करते हैं तो वो कहाँ से स्टार्ट हो रहा है? फ्रॉम द स्टर्नल एंगल एंड देन इट फॉर्म्स अ कर्व एंड एंड्स एट द स्टर्नल एंगल. ठीक है, तो स्टर्नल एंगल देखें बन गई है बाउंड्री. तो आर्च ऑफ एओर्टा लाइज इन द सुपीरियर मीडियास्टिनम. तो वो मिडल मतलब इंफीरियर मीडियास्टिनम में तो आ ही नहीं रहा ना. इसको हम यहाँ पे देख लेते हैं जी. इस तो वो शुरू हो रहा है लेकिन वो बिल्कुल वही एग्जैक्ट पॉइंट है उसका ना. यहाँ से ये यहाँ से ही स्टार्ट होगा, इस तरह से कर्व बनाएगा और फिर ये जो है एंड भी यहीं पे हो जाता है. तो इट इज नॉट द कंटेंट ऑफ द मिडल मीडियास्टिनम. मतलब आर्च ऑफ एओर्टा जो है उसका नहीं होता. बाकी जो ग्रेट वेजल्स हैं वो जो है वो असेंडिंग एओर्टा जिस तरह स्टार्ट हो रहा है तो वो जो है इट इज वन ऑफ द कंटेंट. ठीक है. Any other question? सबसे पहले तो आपको डेफिनेशन आनी चाहिए मीडियास्टिनम की. बेटे एक ओवरऑल बात आपको कहनी है. फर्स्ट ईयर स्टूडेंट्स, वॉइस का वाइवा मैंने तो नहीं लिया है तो मुझे नहीं पता कि आप किस तरह का वाइवा देते हैं, लेकिन एक ओवरऑल सजेशन है कि वाइवा थोड़ा प्रिसाइज होता है और जो आपसे क्वेश्चन पूछा जाता है ना उसी का ही आपने आंसर देना. इतना अगर आप हैफेजर्ड वाइवा देंगे तो आपके मार्क्स नहीं अच्छे आएंगे और आप लोग जो है वो अच्छा वाइवा नहीं देते हैं. डी ग्रेड नहीं कर रही, आपको एक सजेशन दे रही हूँ कि थोड़ा सा इम्प्रूव करें और थोड़ा समझने की कोशिश करें चीज़ों को. जिस तरह बेसिक जो है हम स्टार्ट ही बेसिक से करते हैं. जिस तरह एक टॉपिक आप ले लें मीडियास्टिनम तो एटलीस्ट आपको डेफिनेशन आनी चाहिए. किस तरह ये डिवाइड हो रहा है, कौन सा स्ट्रक्चर है जो इनको डिवाइड कर रहा है. तो दीज आर द मेन पॉइंट्स. डिटेल में तो हम बहुत बाद में जाते हैं जब आप बहुत अच्छा